And we can't hear you if you're out there. I think we're doing a combined tech
Okay,
check and
sound check. Can you hear me now?
yeah, and we can hear you now.
Okay. Yeah, my background was that I was patient safety and quality improvement for the Alaska healthcare system. Basically working for Alaska Native Medical Center as well as Joint Base Elmendorf. The my background is project management as well as process improvement. I've been involved in very large scale computer migrations and integrations. So I thought this would be a good fit for my qualifications because I can ask questions.
Right. Welcome.
Thank you, Anne. And then if I pronounce your name wrong, please correct me. Doris Carago.
Hi everyone, my name is Doris and I have mixed backgrounds. But my relevant background is I currently work for a CCO in health equity, and I I think it would be I think it would be a weight off the shoulders of our members if there was universal health care. They already deal with so much, and we receive a lot of input from them on a monthly basis due to the meetings that we hold, and they're drowning. And if there was just a way to help alleviate that and give them more support, that would be really great.
Thank you, Doris. Douglas Flo.
Hi, I'm Doug Flo, and like Bruce, I've been in healthcare over 40 years. I retired finally earlier this year after serving as the CEO for All Care Health, ACCO, in Southern Oregon for 27 years. I was before the CCO. I began there when we were an IPA and OHP plan, and I had the honor of watching and working with Bruce when the CCO started in 2011 and 12, and it was a very interesting experience and learned a lot. I've had a chance, like Bruce, I've been in public health, I've had academics as well, and health planning. I've worked in healthcare in 4 different states, and it's been a good experience. My one thing I like to watch as this evolves is I think the CCOs, and when they're working right, they had an opportunity for local voice. And I'd like to see the local voice somehow maintained in a reasonable fashion, if we can, going forward. That's one of my goals anyway. So thank you.
Thank you, Doug. Lori Hoagland.
Hi, I'm Lori Hoagland. I too have been in healthcare for 40 plus years. I currently am working at La Clinica in Southern Oregon, a school-based health center in Central Point, and part-time. I had the opportunity to see Sweden's healthcare system when I was before I started my career and education in college. I was an exchange student and lived with a family there and actually spent time working in their local rural health system there back in 1976. So I've kind of been working toward this goal for a few years. Was hoping to get there before I retired, so I'm not retired yet. Anyway, I worked at Kaiser Permanente for over 25 years and was very active with the nurses union there, and also on the board of California Nurses Association with their efforts to work toward publicly funded healthcare in California. So have been interested and involved my whole career. I moved to Oregon in 2012 and started working at La Clinica and got involved with Healthcare for All Oregon. I'm the local chapter chair of Rogue Valley Healthcare for All Oregon. And yeah, very excited to be part of this operations committee. Thanks.
Thank you, Lori. Michael Horry.
that's me. It's nice to meet everyone. I've had healthcare experience. I worked at OHSU for a few years in the School of Medicine, and then after that, I opened up a chain of TMS clinics here in Portland and got to deal with setting all of those up from the very beginning. So I'm hoping that some of my experience in financing and operating from scratch clinics will help us to smooth that process, because I'm sure, as we all know, it's a horrible process to try to get paid for anything. And as a clinic, that's really hard if you never know when you're gonna get paid. So I think if my goal here, if we could get doctors paid quickly and focus on the things that are most important, that would be an amazing goal. So
Thank you, Michael. Paul Stanfill?
Yeah, can you hear me?
Yeah.
Yes.
Okay, good. My name is Paul. I work at Lane County in the behavioral health division. I've been working there for almost 7 years now, and I'm very lucky that I ended up working in behavioral health, because I've learned a lot about myself and my own upbringing and my own mental health through this job. So I'm bringing some experience with working with CCOs and building authorizations with utilization management and stuff like that. But the majority of what I'm trying to bring is just shared lived experience. I've been through a fair number of the types of programs that a lot of our CCO Medicaid members are experiencing, and I would like to take that experience, and especially the frustrations people have, and find ways to prevent that moving forward. And I think this is a major way to try and do that.
Great. Thank you, Paul. Paula Weldon?
Hi, can you hear me?
Yes.
Yes.
Okay. I come from, I'm Paula Weldon, come from a healthcare IT background. And most recently, for the last 11 years, I've been working for a nonprofit health information exchange here in Oregon. And our goal is to have data available where the patients go. So we as patients don't have to tell our story over and over, reduce duplicate tests, just, hopefully the data is where we need it. And so I'm very interested in universal healthcare. I think that would help. Even now, there's still issues with data being available for us as patients, for all of us. We're all patients too. So that makes the story, that's what the story is. So anyway, I'm happy to be here.
Thank you, Paula. Sarah Fouch?
Am I unmuted now? Yes. Okay.
We can hear you.
It's Sarah Fouché.
Thank you.
Yeah. And I live in Eugene. I'm a nurse. I work in a memory care facility. And before that, I worked in long-term care. I spent about half of my life with public health in Canada. I grew up in Canada and a little bit in Japan. And then about half my life here in the States. And I've been on OHP. My kids have been on OHP. We're lucky to have that in Oregon. So having grown up in Canada, it's a no-brainer for me about the idea of universal healthcare. I got involved with Healthcare for All Oregon about a year ago. And before I was a nurse, I have a background in nonprofit management and social justice and bridging people with and without disabilities together. I'm very excited to be doing this work with you all.
Thank you, Sarah. Judy, if you're available to come off mute. Judy Richardson.
Hi, I'm Judy Richardson, and my apologies for just being on voice in a few minutes. I'll join by video. I've been a family physician for 20 years, and I work at OHSU where I teach graduate students healthcare strategy and economics. And I live in the Columbia River Gorge, which explains my commute and underestimating the amount of time it would take to get back to my home office today. I, along with Bruce, am really excited to meet all of you and humbled to be in a group that's so diverse and rich and experience. I get to learn a lot from all of you. Thank you. That's it.
Thank you,
And I'll
Judy.
just chime in. Judy is the co-chair of this committee and the co-chair of the governance board.
Yes, thank you very much, Bruce. And then we also have Rosalind Lindsay and Laura Byerly who aren't here, so that maybe they'll join later, but otherwise we are all set. Bruce, are you okay if I go right into a little tech check?
Yes, please.
Wonderful. Okay, so for anyone that is newer to Zoom, this is, oh, actually, Rosalind just joined, so
Great.
let's get her added really quick. So we'll come back to her while I do the tech check. Just a couple of notes that if you'd like to change the view, that's all on your end. You can change from speaker to gallery. Just the big things to note here are that members of the public are able to join these meetings and view. They just aren't able to connect their audio or their cameras. So if you're able to connect your camera just so that people know you're a committee member, that would be great, but it is not mandatory. So if you can't have your camera on, that's okay. When you do want to speak, please just click the raise hand function, and either Bruce, Judy, Jenny Donovan, who is staff, or myself, Katie DeLuca, staff, will call on you to share your comments or your questions. There's no meeting chat, so we'll really depend on that raise hand function. And
there it is, Rosalind.
yeah, so this is actually perfect timing, Rosalind. We were going to come back to you. And we just got done doing introductions. So if you wouldn't mind just sharing your name and then just a little bit of background of what brought you here today.
And Rosalind, we cannot hear you if you're talking. Rosalind, we still can't hear you.
Can you hear me?
Yes, there we
Now
go.
we can,
Okay.
yep.
I've been listening the whole time. I've been on cell, so apologies. Decided to make the conversion to Zoom. So hi everyone, nice to meet you all. And I was desperately looking for the chat, so I get it now. My name's Rosie Lindsay, or Rosalind, and I'm a lifelong Oregonian. I've worked in, I think, 5 health systems throughout my career, but I currently work for Optum. Yes, I do. Lots in the news, but Senior Director of Technology. But I come to this committee as a Oregonian, first and foremost. And I'm actually, sorry, I'm going to get choked up. I'm actually getting care for my daughter in Utah because it's so bad here. And I apologize for getting choked up, but I am actually what I would say about operations here is that people are so angry. Physicians are angry, staff are angry, nurses are angry, technology, the whole 9 yards. And so currently work at Optum, been here 10 years or 2 years. Prior to that, worked for Ocean, a nonprofit technology company, leading Epic implementations. Over that, Kaiser Permanente, run it, serving as a practice director in operations, OHSU, etc. Was a scribe for how I kicked off my career. But I apologize for getting choked up. I didn't know that would happen to me. But I just am so excited to join you all. I feel like being in tech, that often seems like quote unquote an answer here. But I feel like if anyone can really improve operations, we can do it. And I just remember the kickoff of my career with Kit Sauber speaking on the Hill at OHSU, talking about exactly this, like, why are we not on one health plan? So sorry about that, but I've been listening to all of you and thankful to be here today.
Welcome.
Thank you.
And I'll turn it back over to you, Bruce.
Actually, can we just take 2 seconds and have all the staff introduce themselves so people know you? Katie, let's start with you.
Yeah, wonderful. My name is Katie DeLuca. I'm the executive assistant for the Universal Health Plan Governance Board. So we have all communicated together already. So it's just nice to see you all in person. And I will be the point of contact if you have any questions about meetings, or if you need to find materials, or if you anything at all. Come through me through the UHPGB email that we've been communicating through, and I'll make sure to always direct your questions to Bruce and Judy or Jenny or however it may be. So I'm very happy to be here supporting you all in this work. So yeah, thank you. Jenny, I'll turn it to you.
Thanks, Katie. Thank you, Bruce. Hi, everyone. My name is Jennifer Donovan. I go by Jenny. I am very excited to start the Operations Committee. I am the Senior Policy Analyst for the Universal Health Plan Governance Board. So I will be helping out with research for all of you as you go into different subject matter areas. I'll be working with Bruce and Judy on the agendas for the committee meetings and working closely with Katie to set up meetings and making sure that you all get materials in a timely way and that we're responsive to what the committee needs. I've been in Oregon government for about 10 years in mostly policy and legislative roles. And so committee management is a new and fun thing for me. And I'm really excited to be part of this particular committee. I'm very interested in operations and really excited to work under Bruce and Judy for this committee. So thanks, and looking forward to the work we do.
We also have 2 members of our OHA staff that are also here supporting the committee. So if they wouldn't mind introducing themselves, we'll start with Jessica Marino.
Yeah, thanks. Hi, Katie. Hi, everyone. My name is Jessica Marino. I use she, her pronouns. And yeah, as Katie mentioned, I'm with the Oregon Health Authority, and similar to Jenny, here to provide support, research data, kind of whatever information we have available at the Oregon Health Authority that can help forward this work. I am here to connect you all with that. I've only been here for about 2 months, so a big part of my specific role is connecting you to the people who can connect you to the info you need. But yeah, I'm really eager to be here and help support. And yeah, it's just wonderful hearing the diversity of backgrounds that you all have. So thank you for sharing. And I'll pass it to Danielle.
Hi, good afternoon, everybody. My name is Danielle Ross. I am also supporting the Universal Health Plan Governance Board in a research capacity. I was born and raised in Colorado, and as soon as I moved to Oregon, I started working for the legislature, assisting the House and Senate committees on healthcare when Rep. Greenlick was the chair, and then as Rep. Salinas and Rep. Nose took over, I have seen a lot of health policy development on the legislative side, but I'm so excited to be on the implementation side and see what we can do with these ideas as we make them more concrete and put them into action. So very excited to support all of you in this work.
Okay, fantastic. So as I indicated, part of today is really going to be background and administration. And we're going to start by bringing everyone sort of up to speed at same level about what's happened here in the state over the last couple of years with the Joint Task Force on Universal Health Care. So I am going to walk you through that real quick. If we could pull up the slides, Katie. Maybe not.
Are you not seeing it on your end?
I'm not. Are others?
I'm seeing the forward of the slides.
Huh, I'm not. How come that is?
Well,
okay. I'm just going to I have a copy here, so I am just going to go through those.
Perfect.
How's that? And I'll ask you
Is the rest of the committee seeing the Joint Task Force slide? Can we just get a thumbs up from people to see if everyone else is getting a? Okay, good.
Bruce, it's possible that at the top of your screen, if you kind of scroll up in the top left corner, you'll see like Zoom Workplace, and then to the right, you can click on meeting, or you can click on Katie DeLuca's screen, and that will toggle between.
Now I'm on Katie DeLuca's screen. Thank you.
You're welcome.
That did it. Excellent.
Thanks,
all right.
Jess.
I make that mistake all the time.
And and feel free to interrupt as I go along. Raise your hand if I don't see it. Katie will or Jen will call out. So Joint Task Force on Universal Health Care. was a task force. There were about 20 of us. We met over the course of 2 years, and we came up with some recommendations on universal health care for the state. And I'm going to walk you through those. Next slide. We began, and this was a really important context, and I think some of you on the call today have mentioned some of this, that our current healthcare system is financially unsustainable, it's harmfully complex, and it's socially unjust. That healthcare in Oregon is inequitably delivered and paid for, and that too many Oregonians, whether it's because of race or age, income, where they live, geography, their insurance, have vastly different healthcare access, different quality, and a wide-ranging array of health outcomes. Next slide. So we had an intense public outreach program. We had a consumer advisory committee. We had 7 roundtables with a variety of underserved, underrepresented communities. We had a roundtable with individuals with behavioral health issues. We had roundtables with different ethnic groups separately, with the African American community, with Native American communities and others. We had 6 regional community listening sessions, including one that we did in person and in Spanish. We had forums with healthcare professionals. We talked to hospitals and health systems. We had a forum with large employers. We had a forum with small employers. We had a forum with unions. And all of that informed our work. Next. What we came up with, and I'm going to go through each of these individually, was that a plan in which all Oregonians were covered. Everybody got a robust universal benefit. We eliminated deductibles, copays, coinsurance, and any other out-of-pocket costs. Same payment for all providers, eliminating the current inequities in our healthcare payment system where we pay doctors and others less for taking care of old people and poor people, and more for taking care of the wealthy and the well-insured. Providers would bill one entity in a streamlined manner. Oregonians can seek services from any provider in the state. And we went through all of this, and I'll show you in a moment, but this new system, we were able to cover everybody with a robust benefit, and in the end, it was going to cost less than our current system. Next slide. So let me go through the key elements, each of those things one by one. So I mentioned everybody would be covered. All people who live in Oregon would qualify, no matter their job, their income, their immigration status. Everybody who lives in the state would be eligible. This would be an affordable system because there would be no payment at point of care, no copays or deductibles. What that in essence means is no more medical debt, that no longer would individuals go into debt because of they had a $5,000 deductible health insurance program and couldn't afford that deductible. The covered benefits were based on what Oregon public employees got. That included an oral health, a dental benefit, and an enhanced behavioral health benefit. Why did we choose the Oregon Public Employees Benefit Board? Well, primarily it was convenient and it was a robust benefit, and it precluded us having to spend a year going line by line through a benefit package saying something's in or out. Next slide. Any licensed or authorized practitioner in Oregon who provides healthcare services that are covered by the plan would be a participating provider, meaning no longer would you have a restrictive network whereby if you changed employment or your employer or insurer changed, that you would have a different provider. You could see any participating provider. Participating providers in the Universal Health Plan were not allowed to give preferential treatment to private pay patients. So we didn't want there to be a two-tiered system where if you went to a provider and they were paid through the Universal Health Plan, they would get paid one rate, but perhaps someone with some financial means could pay more to see someone on the side. That would be prohibited by law. The Universal Health Plan would prioritize recruitment of a diverse and representative workforce. Next slide. Providers would be reimbursed directly. The methods and rates of reimbursement would be regionally based, understanding that different regions had different healthcare needs. Capitated models and other alternate payment methodologies could be used. And this was really key. This would really be an opportunity for clinicians around the state to work collaboratively with the Universal Health Plan about how to get paid, how to do utilization review and quality improvement. Right now, if you're a healthcare provider, you've got contracts with 5, 10, 15, 20 different insurers, each of them with different payment methodologies, different quality standards. This would be an opportunity to streamline all of that and to have clinicians work with the Universal Health Board to figure out how best to do universal utilization review and quality improvement. Next slide. Governance is key. And we'll be talking about governance issues certainly in our group. The Universal Health Plan would be administered by a state single-payer entity and governed by a nonprofit public corporation subject to public records and public meeting laws. In essence, a transparent, publicly owned corporation. Board members would be appointed by the governor, confirmed by the Legislative Assembly. We did contemplate having regional entities that would advise the plan on how to respond to the unique needs of diverse communities around the state, and that there would be a government-to-government relationship with tribes. Private insurance would have a limited role in this new system. Insurers would be able to offer complementary insurance for benefits not offered by the Universal Health Plan. So if there were certain prescription drugs that weren't covered, the health insurers could insure for benefits not offered by the Universal Health Plan. The biggest benefit that we did not factor into our plan was long-term care. After a long discussion, the board, the task force felt that at this point in time, that we needed more work on how to integrate long-term care into a universal health care system because so many people in this state do not have universal health care. The Universal Health Plan could, however, contract with third parties, including insurers, for benefit administration to pay claims. Next slide. Equity was a big piece of our considerations, and the Universal Health Plan really removes some key obstacles to equitable care. First and foremost, everybody in the state would get the same benefit. No more, I would have a good benefit and someone else would have a poor benefit. Everybody would have an equitable benefit. There'd be no cost sharing. Provider payments would now be the same. So whether you were low income, high income, old, young, your provider would get paid the same for providing care for you. These are structural inequities in our current healthcare system that would go away in this new system. Contributions would, and we'll talk about payment, would be based on ability to pay for how to fund the plan. And the plan would work to address issues that affect health outcomes, including housing, education, nutrition, violence, and racism, with the understanding that it wouldn't be up to the universal health plan to be totally responsible for these issues, but the universal health plan needed to be at the table to work on these with others around the state. Next slide. We didn't make any final recommendations on a financing system, basically because we ran out of time. We did look at a sort of joint personal income tax and payroll tax as a means to fund it, but we didn't formally take a vote on that. Next slide. So let me just stop there and see if there's any questions before we just go through two more items really quickly. Any questions? Okay, so with that as background, because I think we're building our work off of that. Our governance board has now adopted a preliminary structure based on the Joint Task Force recommendations. And so we've met, and this will sound very familiar, but we've, for the time being, felt that we needed to agree on a broad structure that then we could come back and change. But for the time being, number one, all people who live in Oregon qualify for the plan. The plan will clarify eligibility requirements, including for people who live out of state but work in Oregon. There's still some work that needs to be done around that. The plan will be based on the current PEB benefits with an expanded behavioral health benefit. People who qualify for long-term care, long-term supports and services will continue to receive benefits and services through Medicaid and the Oregon Department of Human Services. The plan will explore coverage of some skilled nursing and home health care. The plan will not require patients to pay when receiving care. No copays, deductibles, coinsurance. Instead, there'll be new revenue sources that will fund the services while protecting families and businesses from financial hardship. People who qualify for Medicare will be covered by the Universal Health Plan to the extent allowed by federal law. Next slide. The plan will work with any individual, group practice, or institutional provider that are licensed to practice in Oregon. The plan will pay providers directly. The rates of pay will be set up by the region to account for different healthcare needs and costs in other parts of the state. The plan will consider the role of TPAs and regional payment authorities. Health insurance companies would not be able to offer insurance to cover benefits or services not offered by the Universal Health Plan. The plan needs to clarify the role of workers' comp. The Universal Health Plan will uncouple health insurance from employment. The plan will seek whenever possible to address social determinants of health. Members of the 9 federally recognized tribes here in Oregon have the option to participate in the plan, and the plan will be overseen by a nonprofit corporation. Next slide. So that's the framework we're working from, and what we'll show you in a few minutes is what we have a variety of committees working on. So we as a group are going to be responsible for how to operate this plan, and you've seen the charter. We'll go through that today. We have a group that's going to put some meat on the bones of how to finance this. We have a group about providers. So you'll see what the other subcommittees are. Lori.
Yeah, the VA, you don't mention the relationship to the VA.
You know, that's not an issue that we've tackled yet. So I think that's one of the things that I believe the Eligibility and Enrollment Committee will be focusing on. Other questions? Okay, we are right on schedule, which is fantastic. So going to talk a little bit about committee administration. Next slide. You've seen, you know, in the agenda which you got, one of the wonderful things that Katie and Jenny have put together is the last column has a place for materials, and there's links on there. So you can click on those links, and you know, we've got board policies and procedures, work plan, the charter, the board adopted values and principles. They're all there. Hopefully you saw some of those. Let's go to the next slide. So there is in that, you know, board adopted policies and procedures. And what we've done is we've pulled out the ones that are germane to this committee. Again, we're the operations committee, but we've pulled out the relevant board policies that you all just need to be aware of. So, you know, first and foremost, the board will conduct its activities and make its records available in accordance with Oregon Public Meeting Law and Oregon's record law. So that just goes without saying. I know that there has been a question out there in floating around amongst people about the ability of board members to talk to each other so that outside of a formal public meeting, yes, we can all communicate with each other. We can talk with each other. We can email each other. We just cannot have a quorum. So there are, I believe, and Jenny, correct me if I'm wrong, there's 12 of us. Is that right?
Yes, Bruce, you are correct.
So a quorum would be 7. So we can never be in any place where there's 7 of us talking and we're not in a public meeting. But I can, you know, if I wanted to talk to Sarah about something, I can talk to Sarah about something. And then we could talk to Paula about something. But we can't create a chain that creates a quorum. So I can't talk to Sarah about something, and then she talks to Lori, and Lori talks to Doug, and Doug talks to Judy, and Judy talks to Ann. That would be creating a quorum. Unless expressly authorized by the board, none of us have the authority to speak on behalf of the board or this committee. The board operates as a single entity when communicating with external parties. Unless specified by the board, all work groups and committees are subject and governed by all relevant board policies and procedures. That's why we're going through these today. Oh, this is great. We've got the slide. This is the slide about communication. And I'm just going to indulge me. I'm going to read through this because the board spent a lot of time on this, and there's been a lot of back and forth and concern about this. The board and its committees hold a firm commitment to transparency and the preservation of public trust. The board also recognizes that it's important to have some limited communication amongst members to facilitate the work of the board and accomplish its deliverables as laid out in Senate Bill 1089. So we've recognized it's important that we communicate and share ideas. Communications among less than a quorum of the board is permitted. So if we have less than a quorum, we can all talk, so long as it does not create a serial communication creating a quorum. Much as I said, we can't create a serial quorum. A quorum of the members of the now it's going to be the committee shall not, outside of meetings conducted in compliance with the public meetings laws, use a series of communications of any kind directly or through intermediaries for the purpose of deliberating, making recommendations, or deciding on any matter that is within its jurisdiction. All board members and committee members are encouraged to take the training offered by the Government Ethics Commission and to submit any inquiries you have about all of this to them. Any questions about quorums, communication? We just want to nip that in the bud right out of the chute today. Lori.
So this refers specifically to our committee conversations with people on the governance board or who are on other committees. Is there any rules around that?
No, this is about if I understood you right, this is about how you communicate with committee members and how board members communicate with each other. How you communicate with your friends on this is up to you. Did I answer that?
I guess the only question was related to if your friends happen to be on other committees of the governance board.
That's a great question. And I would say and we'll get a ruling on this, but I would say this as committee members, we should be transparent. So I think it's important to communicate with other committee members, but don't create a group of what would be more than 6 people that you're communicating with. And we'll get a ruling on that. The whole goal here is to not create a quorum, but to balance the ability to communicate. And I don't know what a quorum would be amongst multiple committees. I don't know. Judy, do you have any sense of that?
I'm not a lawyer, so I should reserve comment. I have an opinion, but let's get an official position, yeah.
We'll find out. Okay, next slide.
I think Michael has his hand up.
Oh, thank you. Michael.
Yeah, I remember in the last meeting, they talked about possibly being issued if you had serial communications, if there were too many of them, even if it was just one person, that might become public or need to be disclosed. And I just wondering if that was ever clarified any further.
Yeah, no, we can communicate. Like I could have a series of 100 emails with you, Michael, or conversations. That's fine.
Okay.
It's just none of those could then morph into, issue 99 that we talk about, we then talk about with 5 other board members individually.
Okay. Thank you.
The board also had some policies and procedures around participation that also flow down to us as committee members. So at a minimum, all of us committee members agree to act in good faith in all aspects of our committee work. This includes being honest and refraining from taking any actions that would undermine or threaten the deliberative process. Expectations of committee members include that we speak respectfully, efficiently, non-repetitively, that we listen to all points of view with an open mind with a goal of understanding the interests of other committee members, that we work towards consensus as a vital community responsibility while respecting minority opinions, that we represent the activities of the board and the positions of others in a fair and balanced manner, and that we not represent the positions of others. I'm hoping that all of us can today agree to that. If you don't think you can, actually, if you'd let us know now, that would be really helpful. And if there are any additional agreements that you want to add, please let us know if we didn't cover the landscape well enough. Okay, I'm seeing some thumbs up. Again, I warned everyone we're going to go through a lot of administrative stuff today. This isn't the fun stuff of creating a universal health plan, but it does create an important foundation for us to all work on. Next slide. Decision making. Oh, Anne, I think you've got your hand up. Or maybe it's now down. Okay. Decision making. A quorum is a simple majority of committee members. We'd like to work, and this is how the board is working, so we'd like all committees to work like this. A consensus model will be used to facilitate the committee's deliberations and to assure that the committee receives the collective benefit of the individual views and expertise of everybody on the committee. As for voting, recommendations to the board will be made by the committee, including when there is consensus, and must be taken by public roll call vote of all members present. Voting should flexibly follow the process set forth in Robert's Rules of Order. Absent compelling circumstances, committee members should not abstain from voting. Voting can be used when consensus is not achieved, and any committee member is eligible to make a motion. If there are votes in the minority, those members in the minority may submit an explanation of their vote and provide alternative proposals. So I think the big thing here is recommendations to the board made by the committee, including when there's a consensus. We'll just take a roll call vote for all members present. Okay, next slide. Jenny, do you want to walk us through this?
Sure.
Because I think you're the most familiar with this. This is really, I think, so everybody understands how the board is going to be making decisions.
Sure. So the board has been working on how it would like information to come from the committees to the board and what the decision-making process for the board will be to give back to the committees. So this sort of outlines a process where a committee takes up some component of what's assigned to them under their work plan, and they start to do some work on that. As they put that together, they create a proposal, which is going to be referred to as a straw proposal. Once the committee creates that straw proposal and puts it together, they're going to bring that straw proposal to the board, and that will usually be the committee chair, and the committee vice chair will take that straw proposal that they've worked on with the committee members to the board as a straw proposal. The board will then take a look at that proposal, evaluate it. The board can at that point say, we like this, we'd like to hear more information about this, we'd like to get community input on this. So they're adopting that straw proposal. At that point, the committee would go into sort of the secondary level of collecting information and doing the work on that proposal. The Communications and Community Engagement Committee would start to get input from interested parties on that particular proposal. And the committee itself may have additional work to do. For instance, the Finance and Revenue Committee, once they come up with a revenue proposal, they might need additional economic input from economic analysts. And so they would collect and gather all of that information. When the board heard that straw proposal for the first time, they said, we're not really okay with the direction that you're taking. This isn't exactly what we want to hear. Here's some feedback. Please go back and work on that a little bit more before we take it out to the public, before we go that extra step of getting the further analysis. So at that point, the board can reject the proposal or move it forward. So once it's moved forward, and it's gotten that feedback from the community and it's gotten that additional analysis, the committee itself will take another look. The Community Engagement Committee will send them some information about what the community said when they were engaged on the straw proposal. If they had particular feedback on different aspects of the proposal, or if, say, an economic analysis came back and said, here's some things you should tweak. The committee would then rewrite that proposal as an actual proposal, not a straw proposal, and give that back to the board with more information, with more detail, and with some community perspective on that. At that point, that's when the board could again say, you know what, this didn't work out the way that we thought it would. This doesn't have the level of detail we want. They could send that back to the committee. They could send it back to the very beginning and say, we don't actually, now that we've seen more, we don't really like this. Or they could say, you know what, this works for us. This is what we were hoping to see. We think this makes sense. But because there's such interplay between the different committees and the different work streams, which we'll go over a little bit later in the meeting, because there's so much interplay, we can't really say at that point that that's been adopted as a final determination of the board. So what we say is that it sort of goes into a decision tracker where we collect the information and we say, this was the proposal that was made. These were the details that were provided, and the board is accepting this proposal. But it may not make it into the final plan because it has to be reconciled with all of the other committee work. So it's going to go into this decision tracker. If once the multitude of decisions that need to be made by the board are made, those decisions get reconciled, and that's what the final plan is. So this really shows the interplay, first of all, between the fact that when a committee brings a proposal to the board doesn't have to accept it. They can always request more information in the first phase and in the second phase. And even if a proposal does make it all the way through and the board says, yes, we like this, we'd like to put this in, our final decision tracker, it may not end up being the final, it may not end up being in the final plan because it may not be able to be reconciled because there's going to be so many decisions that the board needs to make. Does anyone have questions about this process? And Bruce or Judy, is there anything you'd like to add?
The only thing I'd add is just it's always important for committees or groups to understand what their authority is. And I think regardless of the process, which Jenny so nicely laid out, I think the committee needs to understand that we're not final decision makers. We're making recommendations to the board. And, I would anticipate that the board will be in agreement with the vast majority of the things that we put together, but they may not. But ultimately, we're recommending things to the board, and it's ultimately up to the board to be the final decision maker. Okay. Committee meetings. Today is not the fourth Thursday. Although the time is going by so quickly, it sort of feels like the fourth Thursday of December, but it's not. But beginning in January, we are going to meet on the fourth Thursday of every month from 1 to 4. And, we understand that there will be times that folks may need to miss a meeting or two, but this will be our cadence, at least for the next the next 6-8 months. If everybody would be so kind as to get these in your calendar now, that would be great. And I get to turn things over now to Judy, and you get a break from my voice, which is probably you've been looking forward to. Judy.
Thanks, Bruce. Well, thanks, everyone. That was a high-level overview of the task force recommendations and some policies and how decisions are made. And so that may seem mechanical and logistical. I love talking about values and principles because this work is going to be hard. And we're going to pretty quickly get to the edge of where we have a structure set up for us, and we're going to need something to guide us. And I love that values can do that for us. So go ahead and click the slide, Jenny. I also enjoyed hearing about each of you individually and what it is that brought you to this work, because there are echoes in your personal why with these overarching principles and values that the board has agreed to adopt here. And so when the work gets tough, I would recommend you to go back to this document and reread it and remember why this is the meat of the work. So primarily health equity drives this work that we do. And the way that's defined is really outlined in the Senate Bill 1089 as healthcare as a fundamental element of a just society must be secured for all individuals on an equitable basis by public means similar to public education, public safety, and public infrastructure. The second overarching principle is to maximize health, and that includes individual satisfaction and agency in care and public health for the whole community, improving the health status of individuals, families, and community, not the health system, not, business and industry, although those are all secondary. This is improving health. It also is a focus on improving the health of the population. And so this is where I think Oregon shines, and a lot of the innovative work that we've done is focusing on improving the health of populations. The third principle is fair distribution of medical resources. There's lots of details in the document you can click on in the agenda that talk about each of these and kind of where they're founded. But fair distribution of medical resources is also a principle in the Senate bill. And it's basically establishing and ensuring a fair distribution of the resources, providing equitable access to person-centered care. The fourth one is to minimize the financial hardship for individuals and families from medical costs. So you heard this in the task force recommendations as a principle and a defining feature of the job that we're set out to do. We want to minimize those financial hardships by making healthcare available to all. And then the fifth one is community sense of ownership and governance. Both a community sense of ownership, in which the community should have voice in final decision making. And this is really kind of the flip side positive of the public meetings laws, right? The intent of public meetings laws, even though they may seem onerous and a little bit nuanced, is that the work we do is in public. We're here to serve Oregonians, and they should hopefully be interested, but definitely have a right to see how we make decisions and how we're deliberating about things, because they have opportunities, and it's important to hear when they have things to say to us and recommendations and suggestions in the public comment period. Community sense of ownership and governance includes community economic stewardship and principles of good governance too. So that also includes transparency, accountability, community representation, all built in and implicit to building an equitable system. So questions about that so far? Okay. Keep going. So these were adopted by the board in August. That meaningful public participation is where the community should always seek to be inclusive of all people, provide details on the background and current thinking related to a particular issue or project. We'll present the community members with and ask them to consider alternatives and make judgment as to the most attractive alternative to the community. and glean feedback as the guiding perspective in defining terms and decision making. There's a little blurb about targeted universalism there. I'll let you read that. And then we can keep going.
Actually, we get to take a stretch break, but before we do, just any questions for Judy or myself or anybody at this point? So let's do this. Let's take a 15-minute break and come back at 2:20. So I will see everybody at 2:20.
Katie, please just let me know when we're ready to get started again.
I think you can go ahead and take it away, Jenny or Bruce.
Thanks,
Yeah,
Katie.
I think we're all back. What we're gonna do now is want everyone to understand two work plans. One is our work plan. The other is the board's work plan. I'm a big believer in work plans. You know, work doesn't happen magically. It only happens if you've planned for it and have clear deliverables and responsibilities. And so as a board, we've been working to do that. And we've got a work plan for the board. And then we've got a work plan we're going to show you for this committee, which still needs a little bit of work. But I'm going to turn things over to Jenny to walk through the work plan of the board.
Thank you, Bruce. So like Bruce said, the board adopted a work plan fairly early on so that we could start to look at what committees needed to be set up and what timelines we needed. Katie, next slide. So the timelines of the board, you'll see at the top that it says work plan timeline for phase 2 and phase 3. So phase 1 was the board's foundational phase. So it was when the board initially started meeting and doing some foundational work about what is universal health care, who has looked at how to implement universal health care both in the States and abroad, and just giving them a little bit of the administration that we've been doing in this meeting for the board to have time to do that. Once the board adopted a work plan and set up the timeline, one of the things that was important to all board members was that community engagement and communication with the public was something that they wanted to demonstrate their commitment to and start the community engagement and communications committee first. So you'll see that in the plan is the first work stream. Second is communication. So community engagement and communications, I'll talk a little bit more about in the next slide where I talk about what the scope of each committee is, but it's a little bit more narrowly tailored than what we might anticipate, and certainly than what the Joint Task Force participated in, which was very broad community engagement to as many Oregonians as they could speak with and ensuring that they had a diverse perspective. Our charge is a little bit more limited to speak with healthcare providers, with workforce, with insurance companies, and small and large businesses throughout the state. The third work stream is the Finance and Revenue Committee. As Bruce said when he gave the overview of the Joint Task Force, they never made a recommendation on financing a universal health plan. And as Bruce said, they had limited time and they ran out of time to get to this very significant part of a plan that takes an immense amount of work. So the board made the decision that this would be the first substantive committee to begin its work. The idea being that the Finance and Revenue would begin its work and start to pull together what they're looking at for what kind of revenue stream could we pull together and what's that budget going to look like. And then the Plan, Design, and Expenditures Committee would get together, start looking at what are the eligible, who will be eligible, how will we deal with eligibility, what are the covered services and benefits, and then they would start to match that to what the Finance and Revenue Committee is putting together in terms of that budget. We are the Operations Committee. We're actually starting not last, but second to last, because we're the ones who are going to take all of that information from the Finance and Revenue Committee, from the Plan Design Committee, and start to design the actual corporation that's going to run this enormous plan with this enormous budget. And so we're starting with our foundational information, just as Plan Design, Finance and Revenue, and community engagement did. So that we're all sort of on the same page and understanding the various work streams and how they fit together. Because there are multiple dependencies within all of the committees. Once one committee finishes a bit of work, they'll have to pass it to another committee. And all of the work of each committee will go back to that communications committee so that they can take it out to the public and get some feedback and come back. So there's a lot of interdependencies among the committees that has to be accounted for in terms of how we scale out our work plan. So you see that there's a lot of overlap. Finally, the final work stream will be the transitions committee. The transitions committee has not had a charter adopted yet or had members appointed yet. We're going to work through that first, second, third, fourth, and fifth work stream. And once we get a lot of that information put together, then we'll move into a transitions committee. And I think the hope is that we'll have some overlap with committee members from all of the different committees to move into that transitions committee, where they'll actually take on the work of saying, okay, here's all the plan, here's the operations component. How do we switch over from the system we currently have to this new operational system? What's the transition there going to look like? And so we have until September of 2026 to do this work and put that final plan together. Next slide. So like I said, it's really important, I think, for each committee to have an understanding of what's happening in the other committees because of those interdependencies among the committees. So the Communications and Community Engagement Committee, as I said, their focus is a lot more narrow than broad community engagement. They're really tasked with taking elements of plan design, taking elements from finance and revenue, and looking at those proposals, making them bite-sized and understandable to the public, and then sharing that with the public and pulling in feedback that's going to go back to the board and back to individual committees. Finance and revenue. The majority of our quest here is to create a financing structure for a universal health plan. That's our legislation. The Finance and Revenue Committee has an enormous load. So they will be working on different data sources to look at where do we pull information to understand how the financing number that we need to get to, what are the revenue components that are out there that are available to us that we can look at to pull together how we could create enough revenue. And at the same time that they're working towards that, we have our plan design and expenditure committee that's saying, how are we going to pay providers? How do we determine which services are going to be covered? And the way that they framed it is, how do we work with the levers that are available to us between what is eligibility, what are benefits, how much money do we have? And they'll really be working with the Finance and Revenue Committee to try to meld together that number that the Finance and Revenue Committee is pulling down with the plan design elements that are most important and attractive to Oregonians. And then we come in as operations. We need to look at the administrative structure. Once we have all of this plan and we have a budget, how are we going to run this plan? We need to create a trust fund in the state treasury to have the operational funds in a secured place. We have to create an independent corporation to run this universal health plan. And we're talking about a very large corporation with a lot of moving parts. And we need to identify federal waivers. There's a lot of conversation right now about looking at the incoming administration and a lot of unknowns in terms of what the federal waiver landscape may look like through the duration of the next 4 years. We're going to be taking a look at what does Oregon have currently in waivers and what will we need from the federal government in order to implement our plan. And then create guidance for the board on those federal waivers. And then finally, like I said, we'll have the Transition and Implementation Committee. And we really are hoping that we'll pull together a few members from each of these standing committees to come together and bring that perspective that each committee had and put together a transition plan that's going to work with different agencies around the state to say, how is this going to affect your operations? What do you need from us and what will we need from you to start this work? Implement strategies on how to address workforce challenges, which we all know are prevalent in the healthcare industry. And a strategy for legislative recommendations. How are we going to write this into law? What's the legislative statute going to look like when we create this very large public corporation? And then identify the transition costs and start to look at how do we start really ramping up to get the funding in place and move the operations plan along. So all of these are going to depend on each other each step of the way. And there's going to be times where we have to go back and take a look at, you know, something that finance and revenue made a decision on, just like with the decision tracker that I spoke about earlier. They may make a decision that the board says, yes, this is what we want. But we get into operations, and the operations, we may say, this actually doesn't work out with the way that we have to structure this corporation. And we may have to go back to finance and revenue and ask for some changes or for some additional information. So there's a huge amount of interplay among all of the committees doing the work. It's not going to be one committee finishes their work and then we move to the next. It's really going to be a lot of back and forth over time, with us all coming to hopefully a final resolution early enough in about, I think July is the goal of 2026, to really have the plan firmed up in a way that we can start to mold that final report and start to get additional feedback from the public. So the Community Engagement Committee will come back yet again and really go out to the community and ask for feedback on that plan before we present it to the legislature. So any questions about how the plan, the work plan is structured, or any of the deliverables from the other committees?
Questions, comments, thoughts? Okay.
And this certainly won't be the last time we have this conversation about the interplay of committees. So feel free to always ask those questions.
Thanks, Jenny. So let's go to the next slide. So let's spend just a couple of minutes. I hope everyone's looked through our charter, but what we've done here, we've got 2 slides that just outline what are our tasks as a committee. So this is probably the couple of most important slides we see today, because this is going to be our work. And I'd be interested in others' thoughts on this. So one is to review other public corporations in Oregon and understand their administrative structures, because recommendation is that this will be governed by a public corporation. Identify information technology needs and systems that can accommodate those needs. And it's great. We've got a number of folks with IT backgrounds on this group. We need to review complex healthcare organizations and look at how they do claims management, quality control, population health, how they assure the security of their records, et cetera. So that, because we're going to need to make some recommendations about the structure of this new organization. Determine how to manage eligibility and enrollment. We're going to need an eligibility and enrollment system. Recommend an administrative structure. And by this, it's meant, are we going to have one payer, regional payers, and clarity around that administrative role in eligibility, rate setting, and claims payment. We're going to need to determine the operational costs of this new endeavor. This new endeavor is going to pay for care, it's going to monitor quality, it's going to enroll people. We're going to have a structure that does all of that, and we're going to have to figure out some idea of what the costs of that are going to be. Next slide. So we're going to have to then make some recommendations on the overall administrative structure, recommendations on statutory authority and information technology needs for plan operations. We need to help plan to create a trust fund in the state treasury that's going to have revenues routed to it. We need to determine the startup costs, because there's clearly going to be startup costs to this new endeavor. Plan to create an independent public corporation to run the plan. As you can see, not all of these are in sequential order. We're going to need to identify federal waivers needed to implement the plan. And we're going to need to create a a guidance document on necessary steps to engage CMS on federal waivers. So let me stop there and see if there's any questions, comments, and also any additions to operational issues that you think aren't covered in this list. So you can see a lot of work. You know, we're going to try and organize things effectively. So let's move to the next slide. Actually, one more. Yep. So what we've done is, you know, outlined, you know, our hope is that there'll be some reading and some material that folks will have prior to the meeting. We'll meet. So let's take January public corporations. We'll have some material ahead of time for people to read. We'll have a first meeting about putting together a public corporation structure. What does that look like? What should it look like? We'll come out of that with hopefully some broad recommendations, which will then have the board look at and get some feedback from the board. And then in February, we'll have a meeting where we'll hopefully finalize the recommendations around the public corporation, but we'll also begin discussion about federal waivers. And we'll have information about federal waivers. We'll have a meeting where we'll hash out the issues and so on and so forth. In March, we're going to have to look at administrative structure. In April, the administrative role. In May, the State Treasury Fund. And in June, IT needs. And in July, operational costs. We will be able to engage consultants to help us with this, because I don't think there are many of us on the committee that are experts in all of this. So we're going to want some help and some work. I would, you know, for instance, I would imagine that we'll engage a consultant that will help outline an administrative structure and some costs for us. That's nothing I can see that we will initially do as a committee, but we'll look for some outside expertise to help us put together, and then we'll review and finalize. Comments, thoughts, questions? Y'all are a very quiet group. Paul.
I didn't raise my hand, but if I can just say real quick, this is Paul checking in. It's not that I haven't had comments necessarily, but the structure is so clear and it matches so well with my memory of what I was reading before applying, and everything. It's all on point and it just makes sense. So I want to say that, and my questions that I did have were answered by this beautiful slide. I was going to say, how do I prioritize this knowledge I need to gain? And boom, we have a plan right here. So I really appreciate that. I'll be looking forward eagerly to the prepared materials, because I know I'll do some independent research too, but I'm sure you have some excellent knowledge base to start off with. Thank you.
Well, thanks, Paul. Hopefully we can live up to that. Judy.
Yeah, that's very affirming. I'm so glad Bruce isn't just making this up on the fly. No, what I was going to say is in this operations committee work plan, at any time, we may get a bright idea and say, hey, we see the operations elements shaping up to be this thing. And that's when we would generate a straw proposal and kick that over to the board, let the board take a look at it, sniff test and say yay or nay, or yeah, do some more and you're on the right path, or wow, that went way out in left field, go back to the drawing board. That's the moment when we can have that kind of a communication, soft endorsement from the board. So at any point, whether it's after the public corporations, if the committee feels like, wow, this is really clear now after we've heard these presentations, that may be a chance, an opportunity to sketch out this draw proposal and send it over to the board. Or it could be, in information technology, same thing. If we have enough information and the operations committee is thinking, oh yeah, this makes a lot of sense, I wonder if this matches and gels with the other committees, then that's a moment to send a straw proposal.
Jenny.
Thank you, Bruce. I just wanted to also say, in the timeline for the work plan of the committees, the operations committee is slated to run until December of 2025. And so this work plan looks at the deliverables and tasks that we need to cover and sort of sketches out, I would say, sort of a sequence in how we're looking at that work now. But as Bruce was saying, we won't be limited to just one meeting in that 1 month to look at this information. There will always be opportunities to go back and get more information, or, to learn something 3 months later and then want to go back to something that we had talked about earlier and take another look at that. And so this only takes us through about half of the committee's work, with the understanding that there's going to be a lot more time for the committee to revisit some issues and ideas and reconcile with those. And as I've talked about, getting information from other committees and time to sort of work through that material and look at it in light of the work that this committee needs to do.
Thanks. And some of these may take more than 1 month. That's why we've given ourselves some extra time. Well, any other reflections from board members, from committee members? We're really, this is we have one more item. Do we have anybody for public comment?
We do not.
We did have some written public comment, which I believe you got sent, but at every every committee meeting, we'll be seeking public comment if there is any. And there was some public comment that it was written comment that was sent in, which you had an opportunity to review, but I think we answered that. It was, it really was about our issues about talking to each other and quorum. And it was written prior to the board coming up with this final policy. So any reflections, comments for the good of the committee? We'll get ready to learn about public corporations. We thought we'd ease into things with something that was probably easier to get our hands around than an administrative structure and administrative costs. So we'll be easing into things with public corporation. We will meet, our next meeting is the 4th Thursday in January. So stay healthy until then. And we'll see everybody in a few weeks. Wait, hold on. Don't leave. We've got Lori.
Just curious about when we'll be able to start getting some material to read, because public corporations is something I will need to read up a lot about.
Jenny, any thought about when we're going to have our first things come out? Like
Sure.
after the first of the
So,
year?
Probably after the first of the year. So I'll have a little bit more time to research and spend some time with Judy and Bruce to make sure that I'm pulling in the information that they want to see. And then around the first of the year, at least 2 weeks before the committee meets, you'll get that information that you need to review in advance.
And we're already lining up some people who have experience either establishing public corporations or working and running in them now, who will come and talk to us at our next meeting. And feel free, if you find something on, if you find any information that you'd like to share, please, I mean, I hope committee members will feel free to do that.
And in that, just a reminder, if there is something that you want to share with committee members, please send that information to the info email that you get information from us and that you've been using throughout your time as a committee member thus far. And Katie DeLuca, who is our amazing executive assistant, will route that information to the right people, either to Bruce, Judy, and myself, or to a broader audience if that's something that you want to share more broadly. But please continue to use that email address for any information that you want to send in.
Well, it's great meeting everybody. I think we've got a great group and we've got a lot of work ahead of us, but I'm confident that with a great group and great staff that we'll get through it all. So get some rest over the ensuing few weeks and we'll see everybody at the end of January. Take care.
Thank you.
Thank you.
Thank you.